Now let's start to learn next part, infarction. It belongs to abnormal materials in blood vessel. Conception of infarction, an area of ischemic necrosis caused by occlusion of either the arterial supply or the venous drainage in a particular tissue. The common causes of infarction is arterial occlusion, account for 99%, maybe thrombotic occlusion or embolic occlusion. Uncommon causes of infarction, atherosclerotic with intraplaque hemorrhage, arterial compressed or twisting, local arterial spasm. Following factors will influence development of infarction. 1. Nature of the vascular supply. Lung and liver have a dual vascular blood supply and are relatively resistant to infarction. Kidney and spleen with end arterial obstruction cause infarction. 2. The rate of development of the occlusion. Slowly developing occlusions are less likely to cause infarction. For example, if one of the coronaries is slowly occluded, flow within this collateral circulation may increase sufficiently to prevent infarction. 3. The susceptibility of the tissue to hypoxia. Neurons suffer irreversible damage after 3 to 4 minutes of ischemia. Myocardial cells died after only 20 to 30 minutes of ischemia. Fibroblasts remain viable after many hours of ischemia. 4. Oxygen content of blood. A hypoxic tissue is susceptible to infarction. Congestive heart failure is susceptible to infarction. Classification of infarct is dependent on with or without hemorrhage. It divided into red or hemorrhagic infarct, white or anemic infarct. According to presence or absence of microbial infarct, it divided into septic or microbial infarct or bland infarct. Gross appearance of infarction. Its shape depends on the pattern of vascular supply. In lung, spleen, kidney, infarction is wedge shape. Heart, infarction is irregular shape. It is irregular. Intestine, infarction is loop shape. Color, according to with or without hemorrhage. Texture, according to histologic type of the necrosis. As for coagulative necrosis, the texture is hard. As for liquefactive necrosis, the texture is soft. Red infarct occurs 1. With venous occlusions, such as ovarian torsion. 2. In congested tissues. 3. In loose tissues, such as lung, that allow blood to aggregate in the infarcted zone. In tissues with dual circulation, for example, lung and small intestine, permitting blood flow from a parallel supply into necrotic area. Red or hemorrhagic pulmonary infarction. Arterial occlusion usually does not cause pulmonary infarction because of dual circulation, pulmonary artery and bronchial artery. Red pulmonary infarction occurred in this situation. Pulmonary arterial occlusion, pulmonary congestion arise from left heart failure. The blood flow of bronchial artery cannot overcome the resistance of congestive pulmonary vein, so the infarction happened. Here shows dual circulation for the lung, pulmonary artery and the bronchial. Pulmonary artery and the bronchial artery. Pulmonary artery is obstructed in normal state. Bronchial artery will provide blood supply for lung, but pulmonary vein backflow is hindered because of left heart failure. Chronic lung congestion and the alveolar hemorrhage were induced. Then bronchial artery cannot overcome the resistance of congested pulmonary vein and capillary bed, so hemorrhagic infarct happened. Morphology of hemorrhagic pulmonary infarction. Gross hemorrhagic, roughly wedge-shaped, Apex in occluded vessel, base is on the pleural. Microscopy. Coagulative necrosis. Along the margins of infarct, there are inflammatory response. Lung necrotic lung, congestive. It shows hemorrhagic red infarct. Roughly wedge-shaped. Apex in occluded apex in occluded vessel. Base is on the pleural. Lung necrotic lung is congestive. Here is congestive. Here is coagulative necrosis and hemorrhage. We call it as infarct area. Coagulative necrosis, all nuclear disappeared, but the outline of the tissue architecture is still recognizable. A narrow rim of the inflammation is around the infarction. Hemorrhagic infarct of intestine. The necrotic intestinal canal is dark red, hemorrhagic. The peristalsis disappeared. Outcome of hemorrhagic infarct. Infarct is replaced by granulation tissue. We call it as organization, scar form. White or anemic infarct. It was caused by arterial occlusions without obstruction of venous drainage. Usually occurred in solid organs such as heart, brain, spleen, and kidney because of poor bypass circulation. White anemic infarct. Gross morphology. Firm and pale. A narrow ring of inflammation around the region. Shape. Wedge shape or irregular map. Shaped. Wedge shape. In kidney, spleen, apex, occluded vessel, base, periphery of the organ. Irregular or map-shaped in heart or brain. Histology of white or anemic infarct. Ischemic coagulative necrosis. Ischemic brain injury results in liquefactive necrosis. Inflammatory response along the margins of infarct. Consequence. Infarct was replaced by granulation tissue and finally scar formed. It shows spleen anemic or white infarct. Wedge-shaped, firm, pale infarct in the spleen with a narrow ring of hyperemia. Apex here to an occluded vessel. Base here in the periphery of spleen. This is anemic infarct in kidney, was replaced by a large fibrotic scar. This is normal kidney. This is borderline, a narrow ring of inflammatory response in here. This is infarct of kidney. Renal anemic or white infarction. Ischemic coagulative necrosis. Almost all nuclei disappeared within the infarction, but the outline of the tissue architecture is still recognizable. We see this is glomeruli, this is tubule. Anemic or white infarct in heart. Irregular or map-shaped. Pale infarct in the heart with a narrow ring of hyperemia. Cerebral anemic infarction. Liquefactive necrosis. An infarct in the brain showed dissolution of the tissue here and here. Septic infarction. It occurs when bacterial agitations dislodge from a heart valve, embolize or microbes seep into an area of necrotic tissue. The infarct is converted into an abscess with a greater inflammatory response. Clinical signification of infarction. The most common infarcts are in heart, lung, and brain. Myocardial and cerebral infarction is the predominant causes of fatal disease. Renal infarction does not have the paramount importance. Ischemic necrosis, gangrene of the lower extremities, primarily related to diabetes. Clinical outcomes depends on site and its size. Summary: infarction. Infarcts are areas of ischemic necrosis, usually coagulative necrosis, most commonly caused by occlusion of arterial supply, arterial thrombi, or embolization. Those infarcts caused by arterial occlusion, accompanied with venous occlusion, or in loose tissues with dual blood supply, are typically hemorrhagic red. Infarcts caused by arterial occlusion in compact tissues are pale or white in color. Okay, this slide shows the main contents of this chapter. We have learned hemorrhage, edema, hyperemia, congestion, thrombosis, embolism, and infarction. There are some relationships among them.